Hi everyone. Today we're going to be talking about our new product, GOUTart. So let's get started. So gout, what is it exactly? It's when monosodium urate crystals form and build up, and that usually happens around a joint. The symptoms can come on really quickly with significant pain and warmth happening and redness. You can see in this picture here that the swelling is significant, and it's around this joint in the big toe that it's the most common site, mostly because it's like due to gravity being the lowest sort of joint in your body. But it can happen in any joint. The pain will usually peak within the first 24 to 48 hours of the first symptoms starting, and it can last anywhere from 3 days to 2 weeks, but I've seen it last longer in some people. So, risk factors for developing gout. We don't know exactly why, but there's probably a bit of a genetic component. But essentially, having elevated uric acid levels in your blood is the most common cause of gout or risk factor associated with having gout pain. MSU crystals are more commonly to develop in the joints as the uric acid levels rise, which we can see here in this picture that the higher the uric acid level, which is the numbers on the bottom, the higher the incidence of gout. And you can see here that gout is a little bit more common in men than women. So the current treatment options for gout, NSAIDs and corticosteroids, just pharmaceutical anti-inflammatories. There's also pharmaceutical medications that can help reduce uric acid. They're pretty intense pharmaceutical drugs, not the easiest ones to take. So it's good to try to do some more natural options. Some natural options include certain dietary changes, so limiting purines, which are found in higher levels in meat, fish, shellfish, and also legumes, because purines can lead to higher uric acid levels. Fructose and sucrose also possibly increase uric acid levels, and lowering dairy and salt may also lower uric acid levels, but there's just some limited research on that. Losing weight can help reduce uric acid levels, and then some certain natural supplements, which is what we're going to talk about with our product, GOUTart, today. So supplements that have shown to help gout, and specifically uric acid, vitamin C. We've seen some studies that show significant reductions in uric acid when supplementing with vitamin C, usually around 500 to 1,000 milligrams. Tart cherry juice is probably one natural product that's been investigated the most for gout. And we can see here, at least in this study, that they had a 19.2% reduction in uric acid levels versus placebo after taking it for 4 weeks. And that's what this chart is showing here. They took 1 tablespoon of tart cherry juice per day for more than 4 months, and this resulted in a significant reduction in gout flares, so 2 versus 6 per year. So it's maybe not getting rid of it completely, but it is definitely having a significant benefit. And then these 4 ingredients that are in our GOUTart product have also been very helpful for gout, mostly because they are each anti-inflammatory in themselves. And then devil's claw, along with its anti-inflammatory, it's also got analgesic or pain modulating properties. And then some studies have shown it may be able to reduce uric acid levels as well. Curcumin, same thing, anti-inflammatory, and may also inhibit uric acid production. And then we've got our celery seed. Again, same thing, anti-inflammatory, may reduce uric acid production. And then bromelain, again, dealing with inflammation and pain. So all of these probably work on the inflammatory pathway a little bit differently, which is why it's nice to have all of them together to have a bit of a synergistic effect on inflammation. So this is our GOUTart product. The primary ingredient being tart cherry. We've got 3.2 grams in there. Then we've got a good dose of curcumin and celery seed and devil's claw. The vitamin C is a little bit low, but it's good that it's still in there. And then we've got the bromelain in there as well. 1 capsule 3 times a day is what is recommended to be taken. I would recommend actually that you could suggest that more vitamin C be taken. So you could pair that with one of our vitamin C products, as well as omega-3s, just to help, again, further with the inflammation. It works really well with curcumin as well, to help curcumin absorption. And this product is probably, like all the other natural products for gout, better to be taken as a prevention, and sort of decrease the number of flares that they could have in a year rather than in an acute situation. But that still being said, I would still recommend that someone take it if they're currently experiencing a gout flare. I would just suggest that someone wants to take this over a long period of time to try to prevent them from even getting to the point of a gout flare, rather than having it like as an immediate impact during a gout flare. So some side effects and interactions you just want to be maybe a little bit aware of. Both devil's claw and celery seed can interact with a couple of different medications. So it's something that people should kind of be aware of if they're taking it. And then sometimes, just like most herbs, they can cause a little bit of digestive upset in some people. So just a summary on our product here. I really like that it's a very comprehensive support for gout. Not only do we have the tart cherry and the vitamin C that's definitely shown to reduce uric acid, we're sort of attacking inflammation from a couple different ways with the combination of herbs that we have in there. So it's nice that you're getting it all in one package. While I said we could do a little bit more with the vitamin C, I think it's nice that this particular product has got a little bit of everything in it. It can cause some digestive upset in people, like I said, but taking it with a meal will probably help with this. So you might want to recommend that. And then you want to watch for some people taking this with medications, especially blood thinners and thyroid medications. But most people would probably be aware of this if they're taking those meds that they've been warned to take caution with taking any supplements. And then definitely not for those with any kidney dysfunction or during pregnancy. And that's pretty much it for GOUTart. Let me know if you have any questions.